First and foremost, what's the purpose of doing this? For surgical hand scrubbing, first, it is to reduce the number of microorganisms on the hands, reduce the risk of transmission of microorganisms to clients, oneself, and among clients. Lastly, it removes resident and transient microorganisms. The purpose for sterile gowning and close gloving is first, to enable the nurse to handle or touch sterile objects freely without contaminating them, to prevent transmission of potentially infective organisms from the nurse's hands to clients at high risk for infection. First, we need to assemble our equipment. Assembling the equipment beforehand saves time and energy. It will also help the nurse execute and deliver an efficient surgical hand washing, gowning, and gloving procedure. For hand washing and surgical hand scrubbing, we will be needing a nail cleaner, a sterile brush, an antimicrobial surgical hand scrub, warm running water from faucet, and a disposable or sanitized towel. For sterile gowning and close gloving, we will be needing a pack of sterile gloves of appropriate size, a sterile pack containing sterile gown, clean flat dry surface for opening gown and gloves. It is also important to ensure the sterility of the packages of gloves and gowns. Now let's prepare for our procedures. First, assess the hands. Nails should be kept short to avoid harboring microorganisms, puncturing the gloves, or scratching the patient. Remove all types of hand, wrist, and arm jewelry. Microorganisms might build up within the jewelry, and it facilitates proper cleaning of both hands and arms. Check the hands for breaks in the skin such as hangnails or cuts. Breaks in the skin or any open sores will increase the risk for the nurse to acquire or pass infectious organisms during the procedure. Second, put on protective attire prior to beginning the scrub. This reduces the risk of carrying and spreading microorganisms inside the operating room. Pull arm sleeves up to shoulder. This prevents the scrub suit from getting wet since wet or damp linen may harbor microorganisms. Now, we're ready to perform surgical scrubbing. First, we need to perform medical hand washing as we would normally do. This will lessen dirt and microorganisms to facilitate a more efficient surgical scrubbing. And we need to rinse our hands by letting the water run from fingertips to elbows until the cleaning agent or liquid soap is removed. This will facilitate the movement of microorganisms from cleanest to dirtiest area. Now let's ready our scrub brush. First, we need to obtain the nail cleaner with our hands. This is because the distal edge of our nail plate may harbor microorganisms and cause contamination. Next, we need to clean beneath and around each fingernail under running water. This facilitates removal of foreign objects between our fingernails. When done, we need to drop the nail cleaner in the sink when complete. Now, we're ready to scrub the first hand. Place all fingers of one hand together and brush across nail tips for 30 strokes. Mentally divide each finger and thumb into 4 planes or sides and scrub each plane separately for 5 strokes. This cleans all edges and ensure that each plane is properly cleansed. Scrub the palm of each hand for 20 strokes using a circular motion. The circular movements create a friction that removes the microorganisms mechanically. Next, we need to scrub the back of each hand for 20 strokes using a circular motion as well. Now let's scrub the first hand. Mentally divide one arm from wrist down to 2 inches from the elbow into 2 or 3 sections or segments. Further divide each section or segment of one arm into 4 planes. This ensures that all edges and planes are properly cleansed and microorganisms are eliminated. Beginning with the section or segment nearest to your hands, scrub each plane with 5 strokes using circular motion. Using the same brush, scrub the other hand and arm using the same technique as we've mentioned. Discard or drop the brush in the sink to avoid any contact with an unsterile area. Next, we need to rinse both hands and arms. Flex your arms and rinse from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. This allows for the flow of water together with the dirt from the fingertips to move towards the elbows. Always keep hand higher than elbows to prevent water from running back from a non-scrubbed area to a scrubbed area. This ensures that water flows from the fingertips down to the elbow since the hand should have the fewest microorganisms. Release water control and allow the water to drip from elbows for a few seconds before moving away from the scrubbing area. Letting water drip in the sink for a few seconds will prevent the nurse's attire from getting wet and harboring microorganisms. Lastly, we need to go to the sterile setup area and dry our hands. Walk backwards into the operating room while keeping your hands elevated at waist level, with the elbows flexed in front of you but away from your body. Pick up the sterile towel by its folded edge without dripping water into the sterile field. Allow the towel to unfold without touching anything. This prevents contamination of the sterile area. Use one end of the towel to dry one hand completely using a rotating motion and moving from fingers to elbows. Drying from cleanest to least clean areas avoids contamination. Use the other end of the towel to dry the other hand and forearm in that order. A clean, dry towel prevents transfer of microorganisms from one hand to another. Lastly, drop the towel into the designated receptacle. This lessens the chance of contaminating scrubbed hands and arms. Prior to scrubbing, open sterile gowns and gloves. Remove the outer wrap from the sterile gloves and leave the gloves in their inner sterile wrap on the sterile field. This is because the outer wrap is unsterile, only the inner wrap is considered sterile. Next, we need to put on our sterile gowns. First, identify the inner surface of the gown and pick up the gown beneath the neckband. Allow the gown to unfold from the top down. Hold the gown just below the neckband near the shoulder. Slide both hands and work the arm's pathway into the sleeves until the fingers are at the end of the cuffs but not through the cuffs. The gown covering the hands prepares the aseptic technique used for closed gloving. Next, have a co-worker grasp the neckties without touching the outside of the gown, and pull the gown upward to cover the neckline of your uniform in front and back. This ensures that the gown is secured without contaminating it. Gowns must completely enclose underlying garments. Now let's put on our gloves. With hands covered by the sterile gown cuffs, open the inner sterile glove package. This is because the inner package is considered sterile, so it can only touch the sterile sleeve-covered hand. With the dominant hand, pick up the opposite glove with the thumb and index finger, handling it through the sleeve. Lay the glove on the opposite gown cuff, thumb side down, with the glove opening pointed toward the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. The sleeve-covered non-dominant hand is a sterile surface, and grasping the uppermost edge will facilitate the application. the dominant hand working through its sleeve, grasp the upper edge of the glove's cuff and stretch it over the cuff of the gown. Pull the sleeve up to draw the cuff over the wrist as you extend or push the fingers of the non-dominant hand into the glove's fingers. This promotes better and easy access to application of the gloves. Now, we need to put on the glove on the dominant hand, in the same manner but now utilizing the other glove non-dominant hand. Extend the fingers into the glove as you pull the glove up over the cuff. Adjust gloves for fit and comfort while maintaining sterility. Placing the glove over the cuff, the second sleeve will close the area between the sterile gown and sterile glove, avoiding the exposure of skin that may potentially contaminate sterile areas. Have a co-worker take the two ties at each side of the gown and tie them at the back of the gown, making sure that your uniform is completely covered. Gown must completely enclose underlying garments while making sure that sterility is not broken. Lastly, we need to maintain sterility. When worn, sterile gown should be considered sterile in front from the waist to the shoulder. The sleeve should be considered sterile from 2 inches above the elbow to the cuff, since the arms of a scrubbed person must move across a sterile field.